Hello and welcome to our Reflections on Ebola program. I'm Sharif Bojang Jr. and you are listening to West Africa Democracy Radio. In February this year, civil society activists and other stakeholders gathered in the Nigerian capital Abuja to discuss some of the key issues pertinent to the sub-region. The event was held under the leadership of the West Africa Civil Society Institute WACSI in partnership with international charity Oxfam. Among the issues that came up is the Ebola virus disease. WADR's Agnes John was there, and in this first of a two-part series, she hosted a mini debate on the virus and its impact on the sub-region with some of the stakeholders at the Abuja meeting.
With me here, we have Madam Nana Asantiwa Afajino. She is the Executive Director of the West Africa Civil Society Institute, WACSI. Nana, welcome.
Thank you very much.
Next to her, we have Mr. Madi Jobate. He works for the Association of NGOs in the Gambia, Tango for short. Welcome, Madi.
Thank you.
And to my left here, we have Ricky Hansen. She is the project coordinator, media and Ebola project of the Media Foundation for West Africa, MFWA. You're also welcome.
Thank you so much.
And thank you for being with us. Ebola has been devastating in our region. Looking at its beginning in the country of Guinea, what would you say are the major issues you can take out of the situation?
A number of things. One, I think that when it started in Guinea, from the information that we've got so far, it started in a village. I don't think that there was enough information. Well, the people themselves perhaps didn't even know what kind of disease that was. And of course, with the kind of culture that we have related to caregiving, you had the community coming together to take care of this supposed 2-year-old who I think was supposed to have contracted it, who then spread it. And then from the information that we had, it also moved across the border because there was a funeral of somebody who had died. So one is information, the lack of information, lack of knowledge about the disease and what it was, the understanding of it, and then the kind of culture that we have, which is one that really is communal, and so it has the involvement of the community and everybody supporting, which made the spread of the disease easy to happen. That was also an issue. And then of course, when the disease became known, you could talk about the unpreparedness of the Guinean government to really address the problem. Could be the same issue about the lack of information and knowledge about the disease, but also the health systems that they had to, address the problem and make sure that they put a stop to it. So all these are some of the issues that I think surrounded the beginning of the disease and also led to its spread in the 3 countries where.
Thank you, Nana. Madi, what do you think?
Yeah, I think to connect from where she was, I mean, information also obtained indicated that the government of Guinea and Sierra Leone and even Liberia at the very beginning sort of either denied or ignored the fact that this is happening to take the appropriate measure, at that time. So consequently, the issue was downplayed, and then it was building, as she said, because of the social interactions and and the way of life of the people. I think one issue really would be, how fast the governments responded to it, and I think that even affected the international community. The international community also did not respond at the right time until really it got to epidemic level, and then all of these interventions started to flow in.
Ricky, do you want to contribute to that?
Yes, let me continue a bit, because we talked about in the beginning, then when they started reacting. And I want to continue in that lane, because when the international community started reacting, when the government actually started reacting and realized that there is this need for information, I think one of the mistakes that it was that they did not respect the traditional or the traditions in the communities. We've been discussing this. There were like a certain way of how you bury people. There's a way of how you nurse people, all this, which was not taken into consideration when framing the information. And I think a lot of the spread could have been prevented if traditional authorities had been included, if the communities had been included in the information sharing. We've seen attacks on health workers, we've seen attacks on journalists, simply because people were not aware exactly of what this disease was. There was some information flowing, but when it's not tailored to the local context, it created mistrust instead of understanding and knowledge. And I think that was also what resulted in this disease spiraling out of control.
Looking at these issues, we realize that knowledge has been a problem, lack of information, and then action not taken at the right time contributed to now this disease becoming an epidemic in the region. What impact did this have on the region? Nana?
Negative. Negative impact. One, you had, of course, social interaction very much affected, because all of a sudden you couldn't even greet people anymore. We know we don't just greet people. You could greet and say hello, but normally you would shake, you would hug, that kind of social interaction was affected. Businesses were affected negatively, because in the countries which had these problems, you had curfews. People could not interact. Even taking taxis, sitting in one vehicle became problematic. Of course, the cultural things, traditional things that we have done, like the cultural ceremonies, naming ceremonies, traditional ceremonies, funerals, were all things that were affected. Some of the things that brought us a lot of joy, like football, the passion that West Africans have for football. You could not even go for to stadia to enjoy a football game, because you didn't want people gathering in one place. That was, this is talking in country. And then you can also talk about the cross-border relations, which was severely affected. I can use an example. I had to go to Cape Verde for a meeting. I would normally have gone through Ivory Coast and then Abidjan and then Dakar to the meeting in Cape Verde. I had to go to Casablanca through Lisbon before going to Cape Verde, and that it made traveling in the region very difficult. It kind of constrained our brothers and sisters in Sierra Leone and Guinea and Liberia, because people did not also want them coming into their countries, even those who were not living in those countries. There are Guineans in the US and in Paris, and Sierra Leoneans who were stigmatized just because they were Sierra Leoneans or Guineans or Liberians. And it got to a point where it even affected the West Africans, because if you are coming from West Africa, it's an Ebola-stricken region. So yes, it has had a very negative impact. Of course, I could talk about education, how it affected people and families, where you had mothers dying, parents dying and leaving children. You had whole families that were affected in a major way by this. So yeah, it has had a major effect. And of course, the economies of the countries, because yes, they were given some resources to support them, but if people are not doing business to get income, they become poorer. And of course, it affects the economies of the country. So it has had quite a number of negative effects on our countries.
Mm-hmm. Yeah, I think someone commented in the Gambia that Ebola is more devastating than an armed conflict, because in an armed conflict, at least, you can do all of those things. Yeah, but, this is, a non-violent kind of conflict, but yet so devastating. So that if you look at, say, Gambia, which is relatively far away, you feel the impact. Someone jokingly said, remember at the time, rightly or wrongly, that even oranges are scarce in the Gambia because oranges come from Guinea, and so I know of instances, in certain communities in the Gambia, is Guinean shopkeepers, in our communities, who would go to Guinea and then come back and, create a commotion in the community, so I think it was very devastating socially, economically. The restrictions, between Gambia and Senegal border, people had, to go through some very many inconveniences to cross the border, So, but, again, these kind of situations create some other, I don't know whether it's opportunities or other forms of probably circumventing the rules or the structures, so that in our borders also, they have the border post, but then people would find a way to circumvent, to get away from the border post in order to get in. So, and all of that increased the scare, that it has caused. And economically, again, far away Gambia, our tourism was affected because clearly, I've known individuals in, Africans and, Europeans in Europe who just canceled their trip to the Gambia simply because Ebola, and as she said, it stigmatized the whole of West Africa, that Ebola is in Africa or West Africa. So, yeah, I think the impact is incredibly devastating, and I hope one day we'll be able to quantify how much it cost us in various forms, really. It's terrible.
It is. I agree to all of this, and the same as you've seen in the Gambia we saw in Ghana. Like we saw how people stopped coming to the country simply because of Ebola. None of our neighboring countries had Ebola, but still it was stigmatizing the entire region. I think another thing that is very important to say when we talk about the consequences is that it's not only short-term, it's long-term. We have children who's not been in school for a year. They have to begin school again. We have their economy set back, I don't know how many years, I don't even dare to guess. And then what I would like to emphasize is the fact that the farmers have not been farming for a year. There's no food in these countries. What we are going to see now as a consequence, as a long-term consequence, is that there will not be enough food. There'll be a massive hunger. That's what's going to happen now. Also as a consequence. So right now we can talk about the short-term consequences, but the truth is none of us know in the long term how devastating it actually is. And that's probably where we have to start setting in now to say, okay, what are the long-term consequences that we can change, or we can try to make maybe a bit less.
During all these processes, there has been responses from organizations, from be it the media, be it donor agencies, be it the United Nations, ECOWAS, and the African Union as a whole. The responses have been many and varied. But would you say they were effective?
Well, I think to some extent, at least with regards to giving accurate information on what Ebola is. Now, you can say that a fair number of West Africans know what it is and how it's transmitted. So I think when it comes to clearing that aspect of misinformation, some work has been done there. The problem, though, is with strengthening the health systems. I know that we have treatment centers in a number of our countries. Do we have enough? Do we have the equipment the PPEs that they need? If there was supposed to be a breakout in any of these countries, do we have them? Are the doctors and nurses, the health workers, are they well prepared in all the different countries to be able to engage and address the issue as quickly as it comes? Apart from those frontline workers, we were talking about the community response. The people within our communities who would be the first responders in some of these cases, have we engaged them enough? I think Rike mentioned our traditional authorities. I even up till now, I'm not sure that we have engaged them enough in the response to Ebola. A lot has been done with health workers, but what about those, in the communities? And we have talked about the fact that in our communities in West Africa, a lot of the time it is women who are really responding, the first responders. Now, through the we have several women's associations in our countries. How have they been engaged? Because we have to bring the response from that level, the national level, to the community level. And that is where I think civil society's role also has to be mentioned. How much have we involved civil society organizations in this? And when I say civil society organizations, I'm talking about NGOs, but I'm also talking about other civil society organizations like the voluntary associations that I have mentioned, to involve them in understanding the issue, understanding what the responses should be, and how the common person could be engaged in responding. That, I think, a lot still needs to be done there. And I also think we are getting complacent in the countries that do not have or did not get the epidemic. Like Ghana, I can say we have relaxed. You don't see that, that it's like people people are, okay, Ebola, yeah, it's not as, it's gone now. It's really not. Maybe it's still there in Sierra Leone and Guinea, but that alertedness to really address it when it came, I think has gone down quite drastically, and we need to keep that alertness and really be engaged. And it's not only Ebola. I think we have to look at how we can have our good health systems in place so that we can address such issues when they arise. I had mentioned earlier that whilst Ebola was raging in Sierra Leone and Liberia and Guinea, you had a cholera epidemic in Ghana. So that is, we have issues, and we need to address the system holistically and not only look at Ebola. Now Ebola is quote unquote gone, and so we kind of relax in making sure that we have good health systems.
Yeah, I think I'll agree with her. The response is effective, to some extent. Mm-hmm. You just have to put that against, without this response, what could have happened. Mm-hmm. So certainly the response has been effective, but it would have been far more effective. I think we could have been able to really handle, that is, totally control, eradicate Ebola by now. If it had been more effective, that is, the various interventions that came from the various countries and organizations, if they are well coordinated, among themselves, number one. Number two, the people who receive them, like the governments that receive them, if they are well managed, the interventions in terms of the structures, in terms of the materials, in terms of the financial resources. So if you look through all these countries, consistently you hear about the health workers demonstrating because they've not been paid. Mm. So you cannot imagine, you can't just understand, why do you have an epidemic like this? People are risking their lives to take care of the sick, the dead, and health workers, individuals, and you need to pay the weekly, some minimal sums, and you still don't pay them, and so that I think is a matter that needs serious consideration. In order to address this thing, and of course, as you said, sometimes these issues erupt, they reach a peak, and then people start to relax. In the Gambia, it was very high. Every office would put up a bucket of soap and water and wash. But then you can see a relaxation of that, and so that is there. But the very important issue that she raised is these health systems. You see, I wrote a piece at the beginning of this outbreak that why are we so bothered with Ebola? Forgetting that every day malaria is killing our people, sleeping sickness, elephantiasis, cholera, as you said, childhood illnesses, in addition to the weak health systems we have, that, the capacity is not there. The services are poor. And so Ebola for me exposes the broader governance issue.
Yeah.
That for 50 years of independence, what has these governments been doing? And I've always cited, if US has their CDCs, the French has their Pasteur Institute, the British had their MRC. Why are our health systems structures for research, for control, for prevention? We don't have it in our country. So for 50 years of independence, we've been sitting there refusing to develop those fundamentals, so that even basic, daily illnesses that you have, you cannot even take care of them. So Ebola comes and you are completely devastated, So I think what this thing has taught us, has shown really, is the, general weakness of the state, and the poor governance, really, because it means the accountability systems are weak. It means efficiency is not there, performance is not there. So basically, it's a culture of impunity that we've ever had in Africa for the past 50 years. Governments just sit there, not doing what they should do. So simple things come like this, and you have to depend on Red Cross, on the UN, on United States, on the EU to come and support you. Is really shameful as Africans, really. That's what I think.
And do you think it's only the responsibility of the government?
Yes, what is the purpose of government? The government is there, elected, given resources to address our needs. Certainly, as a citizen, if I can sweep an area, it's good. If I can go and build some service for the people, it's good. But primarily, it's the duty of the government to develop the people. That development includes protecting their rights, satisfying their needs, preventing them from harm, and stuff like that. So, first and foremost, is their primary responsibility. They don't share this with anyone. Anyone who else can add to that is welcome. But, this message has to be made very clear, to government, to our citizens, to begin to, demand, efficient, effective, responsive services from our people. And that cannot be in the absence of accountability and, of course, empowerment of the people. Because people have to be empowered in the first place to be able to hold the government to account. So I think this Ebola outbreak really should raise the whole issue of governance, of politics in our countries, so that we know how to deal with these things in future. Honestly,
I very much agree.
Thank you.
Because we pay taxes. And why do we pay taxes? For the government to provide services, and the basic service is health and education. So it should definitely be them taking care of that. I think civil society, we have a role in maybe sharing information, but I do not think it's our responsibility to make sure that their health system's working. That's the role of the government. Primarily. With that said, I would also like to say that one good thing, you said that Ebola, it's been devastating for the region, but it has created some opportunities. I would be a bit careful about using that word, but somehow, because after the Ebola outbreak, some structures has been created. We have learned some lessons of how to handle epidemics, of how to prevent diseases. Cholera, the symptoms of cholera is very much the same as Ebola. And just because Ebola stops, it doesn't mean that we should stop washing our hands. So our let's say our task now is